Good evening. Why don't we get started? My name is Jim Greenblatt, founder of Psychiatry Defined, and I'm really pleased to welcome everyone to our kind of free webinar series. Before I introduce Julie, let me tell you a little bit about Psychiatry Defined and our upcoming programs. Here we go. Okay, so in Psychiatry Defined, Um, we have spent the last 6 years trying to educate clinicians on integrative and functional medicine for mental health. One of the thrills of introducing Julie is that she was around 15 years ago when I met her talking about nutrition and mental health. So some of the more enlightened. But we've gone from giving lectures and webinars to producing fellowships, year-long training programs. So we have two starting this summer, general fellowship starting in July, and our pediatric first offering, child psychiatry pediatric fellowship with Dr. Nancy O'Hara, starting in August. Next slide. So please, if you have questions. And then in our kind of free webinar series, I'm going to be giving a presentation next week on ADHD and eating disorders. ADHD is misdiagnosed and poorly treated in young women. And this is a really unique kind of treatment model and helping people understand the gender differences in ADHD. So that's coming up, and that's part of the free webinar series. And I think we have more. And then if you don't know Claire Sennison, she's a UK nutritionist, has been part of our faculty for a year. She's giving this webinar on autism and the impact of health disparities. She also will be providing a 3-month training program on nutritional and factors for autism and ADHD. So again, free webinar. This one is during the day, April 2nd. And what else we got, Julie? Anything else?
I think that's what we got.
That's it. So now we get to, again, fortunate for me and very pleased to introduce Julie Matthews, who is an author of a brand new book she'll tell you about. But again, Julie and I met many, many years ago where she was talking about nutrition and autism. She's a certified nutrition consultant, published researcher specializing in personalized nutrition for complex neurological conditions, particularly ADHD and autism. She's been doing this for over 20 years. She has a master's degree in medical nutrition with distinction from Arizona State University, co-author of 2 research studies demonstrating the efficacy of nutrition and therapeutic diet interventions for autism spectrum disorder. Her brand new book, Personalized Autism Nutrition Plan, she'll tell you about, and looking forward to hearing Julie present this evening. So welcome, Julie.
Thank you so much. All right. So I won't go into much about me. Dr. Greenblatt already did a great job. Just keep going here. Today we're going to talk about starting with the underlying factors involved with autism spectrum disorder, because it really helps lay a framework of why diet actually helps and how you can choose the best approach for it. And then why personalized nutrition is really key. So I've been working, as he said, with families for over 20 years. And it was really over time that I discovered that the most effective way to work with families was to personalize the nutrition approach. And now there is more and more research on that. We will look at some of that today, and I will share some of my experience as well. And then we're going to jump into 2 papers that I was a co-author on along with Dr. Jim Adams. And we'll look at those, and both from the perspective of the paper, but also a broader perspective of understanding autism spectrum disorder and how we can use nutrition to help the condition and a variety of other conditions as well. We'll kind of touch on how they can be, how they're all to some extent related. So not, although a lot of my research is in autism, what we're going to talk about is how there are these underlying factors that I mentioned. And these underlying factors are present in many different mental health conditions. And so, as we address the underlying conditions, we can see improvement with a variety of different conditions. So, while we are going to talk about autism today, it really can help whether we're talking about attention, hyperactivity, anxiety, mood, a variety of different things. And in fact, I did struggle a little with my book in terms of was I going to focus just on autism or was I going to make it broader? Because so many of these principles can help more people. I just want to point that out to people as we get into this today. So let's look at those underlying factors. So in autism, we see inflammation, immune system dysfunction, oxidative stress. We see challenges with the gastrointestinal tract, microbiome, poor detoxification, poor mitochondrial function, endocrine disruption, and various biochemical pathways that are not optimally functioning, particularly methylation, transsulfuration, and sulfation. Those are the three of the big key ones, I think. And these other conditions I have here also share many of these underlying conditions. So pretty much all chronic conditions involve inflammation. And so and oxidative stress. And so when we're talking about ADHD or anxiety, depression, learning disorders, Down syndrome, we can see that in all of these. And also, I won't go through each of these because the point is the same for all of them, but many of these same systems, you can look at any of these underlying factors and find these in individuals with these other types of conditions as well. Yeah, everybody's unique. So some people are going to have more of an immune system challenge. Other ones are going to have more methylation problems. Others are going to have things associated with the microbiome and disruptions there. So everyone will be unique in their presentation, but these are the common underlying factors that we see most common. And diet and nutrition are used, or I like to use them, to directly influence these underlying factors. That's why I think the diet and nutrition works so successfully, is because I'm always looking at what are the underlying factors that affect an individual and how can we use certain nutrients or certain dietary strategies to help improve them. So that's what we're going to do today. We're going to get into diet and nutrition. So individuals with autism spectrum disorder have, they're very different. And you know, in my field, we say if you've met one person with autism, you've met one person with autism. So they have often different root causes and underlying contributing factors. They have different, you know, while the core autism symptoms are similar, different people are going to present differently with those. There are also different physical symptoms and neurological symptoms and different comorbidities for each individual. And these comorbidities can contribute to the severity of autism or the challenge that people have. So people that have autism, that have ADHD, that ADHD compounds a little bit of the challenges that they face on a daily basis. And so sometimes if we can even address some of the comorbidities, that can help improve the quality of life of the individual with autism, in addition to working on addressing those core symptoms of autism. So we call this a heterogeneous condition. And with anything that's heterogeneous, we need a personalized approach. And this is also when we look at studies done on autism. If we see that, you know, maybe diet helped a certain number of people, I think what we need to look at is that if a person has these underlying factors, they're going to probably be really benefit from this dietary approach. But when we take autism as a whole and we take a group of people with autism, we're not looking at those little differences. And so I think that and what I've seen in practice is some of these diets are even more effective on an individual basis, because when we get the right diet with the right underlying factors, we can see quite dramatic improvements. And so when there are a number of studies here on looking at personalized nutrition and therapeutic diets for autism spectrum disorder, as well as looking at just the different ways that people with autism present with the condition. There was a great paper that was written not too long ago, just about a year and a half ago. And these are some of the people that have been in this field for a long time, looking at the rationale for vitamin, mineral, and cofactor nutrient treatments in the precision medical care of ASD. And so they talked about a lot of important factors. They looked at nutrient deficiencies, and they looked at what can cause those deficiencies. So a decreased intake in nutrients. People with autism are often picky eaters. Looking at the different SNPs that are present, the toxins, also looking at autoantibodies, and then the different nutrients that can be helpful. So they looked at B vitamins, vitamin C, E, D, A. They looked at zinc, magnesium, molybdenum, selenium, CoQ10, and other nutrients. And so they state here that since they say ASD is highly heterogeneous in terms of metabolotype, and therefore vitamin and cofactor therapy should be personalized in line with that endophenotype of the child. So all of what we're talking about now, these are important nutrients, but they're going to get the best benefit when they are personalized on that level. And then there's another paper here that I wanted to point out because this is a peer-reviewed paper. It came out actually this year, so very new paper looking at nutritional factors and therapeutic interventions in autism spectrum disorder. And that was looking at some, I think, really interesting factors. So if you're interested in that peer-reviewed paper, you can find that as well. Another peer-reviewed paper that I want to make you aware of, I'm one of those people, I love the research. That's one of my favorite things. So I always like to share some of the latest and greatest that's out there. And so this peer review paper from only a few years ago looked at dietary intervention for autism spectrum disorder and looked at specific things. So they looked at 900 papers. They came out with 21 articles. They selected the areas they wanted to look at, and those included antioxidants and polyphenol compounds, so things that are great with oxidative stress to combat that. They looked at probiotics and prebiotics, things that are really helpful with that microbiome and the gut that we talked about earlier. There's also camel's milk, which actually is one of my favorites. It has a very different ability to affect the immune system and rehabilitate the immune system. So that's a really fascinating area. And then vitamin D and the importance of vitamin D. So this paper goes more into that, and you might want to check that out, looking at the ability for these agents to target multiple systems via that gut-brain axis, and they are devoid of potentially harmful or aggravating effects. We'll talk more about that, about how diets can be very beneficial with very low adverse side effects compared to other things or certain other things. So personalized nutrition, let's go into that and some of the therapeutic diets. These can help improve the symptoms of autism. So let's jump into the two studies. So this is Dr. Adams. He is a mentor of mine out of Arizona State University, where I also got my master's. And we worked on a randomized controlled 12-month trial where he was the lead researcher for that. And I'll go into more about what that was about and my role in that. And then we wrote a paper on the ratings of the effectiveness of 13 therapeutic diets for autism spectrum disorder. So if we look at that first paper, what we looked at, well, a few things that I think really stand out in this paper. Number one is that it's a randomized control trial. It went for 12 months. So some diets go for 3 weeks, 6 weeks. I don't think that's really long enough to really see the true benefit of the diet. So to do it for 12 months and follow them for that long really gave us the ability to truly see how a family might implement a diet and the true potential of that diet. The other thing that this study did was to look at a number of the different individual diet and nutrients that are used and have been successful in the past in studies and in clinical experience as well, and put them together into one approach. And I think this is really valuable because this is how families actually implement diet and nutrition in real life. We don't start with vitamin C and look at the effects of that for a year and then go on to vitamin D and see the effects of that for a year. No, people want to get the best effects they can. And we know that many of these nutrients are synergistic. And so doing them together often gives them that extra level of boost. So this study mimicked more of what real life is like and what practitioners are more likely to recommend for their clients and patients. So it started with a multivitamin mineral formula on day 0. And then approximately 30 days later, each new intervention was added. So after that was an essential fatty acid supplement with EPA and DHA and GLA. And then after that were Epsom salt baths, so that transdermal soaking in a bathtub. Then carnitine. Carnitine can be very helpful for mitochondrial dysfunction, which about 30% of kids on the autism spectrum have. And so carnitine supplementation was used. We're going to find out something I think very interesting about the carnitine, because while not everybody needed it, those that did found quite significant improvements in their quality of life with it. The next was digestive enzymes, and finally was a healthy gluten-free, casein-free, and soy-free diet. And so these are the approaches that we looked at. I helped with the education and the implementation of the healthy, gluten-free, casein-free, and soy-free diet. So a little bit more here. What we found was an almost 7-point improvement in nonverbal IQ. So that is a really quite a significant improvement in nonverbal IQ. We also found 4.5 times the developmental age improvement. So if you look at in a year, you'd expect a neurotypical child to develop 12 months in 12 months. In those that are developmentally delayed, such as those with autism, you're going to see less than 12 months of development in that 12 months, and that makes sense. In the treatment group, there was a significant increase in that over that time frame. So I think I might have a slide on that to show you, but it was 4.5 times the developmental age improvement. So it was over 12 months of development versus I think it was maybe 4 months of development with this group. There were also improvements in these are just to name a few: mood, cognition, language, hyperactivity, sociability, attention, focus, sleep, and more, and improvements in GI symptoms as well. So here's a little bit more of that, so you can see the significant improvement in most of these areas. You will see, I went through some of them already, so I won't read them all. You can kind of read them read them yourself. But you'll see that the blue are the areas of the treatment group, and the orange are the areas of the non-treatment group. So some of them improved slightly. Some of them actually got worse over that period of time. And when you compare that to the ones that are in blue, the treatment group, there was a significant change in almost all of those categories. GI symptoms, that's another one. GI is a big area that's getting more and more research these days. There's some amazing research out. Dr. Adams has done even more research looking at the gut, the microbiome, and I think we're going to learn more and more as the years go on about the significant importance of the gut in autism and the improvement in gut symptoms, which is, just a real improvement in their quality of life. So this looked at a 6-item index for gastrointestinal symptoms and found that the total severity score improved quite significantly. There were also a number of different measures, so I won't go through all of these, but these are a variety of different ways to measure the improvements and in autism, and you can see all the ways that they were significant. So we talked about nonverbal IQ, there's ATEC, there's a variety of things that look at autism symptoms. So 3 special cases that I want to get into on here. We'll start with the girl in a that was in a wheelchair. So there was a girl that had autism in this study, and she had such low energy that when she had to do any substantial exertion of energy, go for a walk, go, more than get to the car, but, go for a walk in the neighborhood, go for a walk at the mall, she needed to use a wheelchair. And after that carnitine supplementation, she dramatically improved in her energy levels to the point that she no longer needed the wheelchair. And after the study, her parents put the wheelchair away in the garage and haven't needed it. So there's just the improvement in the quality of life for that individual. And I think this highlights the power of personalized nutrition, because as I mentioned, not everybody reported that that was a particularly important supplement for them. But for that girl who didn't have high meat in her diet or pork in her diet, didn't have beef or pork, the things that are going to be higher in carnitine, that carnitine was very important to support her mitochondria, it appears, because it really created quite profound results for her. There was a young man that had to be catheterized because he could not urinate on his own. And when he did the gluten-free and dairy-free diet, that challenge went away and he was able to urinate on his own. And the reason that we figured out, his parents figured out, it was dairy that was causing the issue was because he got an infraction of dairy and the symptoms came back. He needed to be recatheterized. Then after a while, everything was fine. He didn't need it anymore. Everything was going well. Then he got another infraction of dairy and he needed that catheterization again. So really just amazing results for some people. Certain foods just really trigger inflammation and challenges for them. And kids or adults with autism often have challenges with gluten and dairy. The third was a boy with severe pica. So pica is a condition where individuals eat non-food items, and it can be very dangerous. Dirt, rocks, batteries. It can be quite severe and threatening to their health and well-being. And so for this boy, after implementing the gluten-free, casein-free, and soy-free diet, this severe pica also went away. So just some really interesting things we often don't think to be associated with diet or nutrition, or at least not that profoundly. So I went through these. I won't go through them too much. We talked about this, but resolving the pica through the nutritional support. So they revealed deficiencies in some very important key nutrients. A week on the GFCF-SF diet, his pica completely disappeared in 1 week. And his improvement was long lasting and maintained the positive changes throughout the study. And so this was a boy with severe pica. So we went through this. Again, I won't go through it. I already talked about it. This man was 27 years old, dealing with chronic urinary retention, and was having a variety of infections and things like that. And so, again, great improvements. And the girl, she was 9 years old. And so, struggling to get into the van, the family van, climb the stairs and those kinds of things. So there's a little bit more, 4 months on carnitine supplementation, and she gained a significant amount of strength and endurance. And within a year, could walk up to 2 miles and no longer needed her wheelchair. All right, let's jump into therapeutic diets. So we talked about these underlying factors. What I have found is that the way that therapeutic diets work is that they address these underlying factors. So I feel that the kind of the mechanisms of action of the diets match up with the particularly underlying factors that the diets can help support. So those are things that the therapeutic diets can remove certain substances that are known to cause inflammation. And we'll jump into those a little bit today. This, as you might be able to guess, is there are many different of the food compounds that we're going to talk about. Gluten, casein, soy, food sensitivities, food allergies, oxalates, salicylates, a lot of different compounds that can cause inflammation. So it's about figuring out for that individual, what are the compounds that are causing that inflammation for them? Then looking at foods that activate an immune response. And I don't mean in a positive way. I mean kind of overactivate that immune system, creating a hyperactive immune response, causing a variety of challenges associated with that. That might be an autoimmune reaction or some other allergy type response. The foods that can interfere with neurotransmitter function. So things like glutamate, for example, that can affect the neurotransmitter there and can contribute to symptoms people have. They can mimic neurotransmitters. One second. So I guess in the case of glutamate, it might be more accurate to say that that's more mimicking or acting. It is acting in that same capacity. Hold on, my screen has decided to, okay. Other ways of interfering with neurotransmitter function may be things that are affecting the microbiome that could affect neurotransmitter function, or with amines or something like that. Foods can cause nutrient deficiencies. And so therapeutic diets aim to add the good healthy foods, but remove the foods that are causing the problem, and removing foods that can deplete the system. Looking at how foods can burden detoxification. So maybe it's looking at compounds called salicylates. We'll jump into those a bit. Or looking at maybe it's corn with glyphosate, things that are going to require detoxification for. Not being able to digest the foods. So maybe in the case of the gut is damaged, maybe things like grains that aren't able to be digested well and can further damage the gut and the microbiome. And then an imbalance in the gut microbiome. So maybe it's removing foods that affect that. So as I mentioned, it might be grains for somebody else. It might be certain fermentable carbohydrates that we call FODMAPs that can affect that. But there's other things as well. There's oxalates and things. So this is just a kind of a high level overview of how therapeutic diets can influence in a positive way these underlying factors. So healthy, nutrient-dense therapeutic diets. So we want to avoid the things that are causing a problem. And most therapeutic diets are really defined about what they're removing, right? Low salicylate diet reduces salicylates. A gluten-free and casein-free diet reduces those foods. So usually it's about what we're taking out. But I like to focus on getting a healthy, nutrient-dense therapeutic diet. So one that's going to be rich in healthy things, like that randomized controlled trial we did, where it was a healthy gluten-free, casein-free, and soy-free diet. So these nutrient-dense diets, when these therapeutic diets, we want to provide protein for those building blocks, those amino acids we need for that protein. We want to get good quality fats for the brain and for good energy. We want to get carbohydrates and fiber to get energy in the diet and for prebiotics. We want to, and long sustaining energy. We want to look at carnitine that we can get from food. We may need supplementation or extra things, but we want to get carnitine that we can use for mitochondrial function. All sorts of different nutrients, folate, B12 that we need for methylation, B6, magnesium, zinc. We need to build and boost neurotransmitter function and also help with that transsulfuration and things. Then looking at fermented foods for those probiotics. So these are some of the things that a good, healthy therapeutic diet can help provide. The nuance or the tricky part here is that we want to avoid those things that they can't tolerate. So sometimes people might have trouble with some of these things. Maybe fermented foods are too high in histamine for them, and we need to look for other ways to get that good bacteria in. So our study looked at 13 different diets: the healthy diet, low sugar diet. I won't go through all these. I'll go through them when I'm going more into the paper itself. But we looked at the effectiveness of 13 different therapeutic diets among over 800 families of children with autism. As part of this survey, there were also components of the survey that looked at nutraceuticals, so those are nutrient supplements, and medications, particularly psychiatric and seizure medications. And so there were papers written on those portions of the study as well. So they're very, I think, interesting thing. Let's see, did I mention it? Maybe I don't. I'll mention it here. The interesting thing about this is that because the same scale was used in all of these different interventions, we were able to directly compare one to another. And we found that diets were significantly better at providing an overall benefit than both nutraceuticals and psychiatric and seizure medications. And nutraceuticals were still wonderful. They performed very well. They were also significantly better than psychiatric and seizure medications. But to notice the power of diet, because people often don't think that diet is that powerful, but the diets actually did the best out of all three of these. And diet was also able to provide a significantly lower rate of adverse effects than the psychiatric and seizure medications. And again, the nutraceuticals did that as well compared to that, but I want to kind of focus a little bit on the diets in this one. But so the diets performed best, but the nutraceuticals and the diets both did significantly better at improving the benefits and decreasing the adverse effects. So here's a little bit on the diets. We can look again at the blue, the overall benefit of the diets, and so you can see all of the diets provided an overall benefit, and all of the diets had a very low adverse effect. And so that, I think, also is very important to see. I mean, most of them were great on both of those. I would say I shouldn't have said most, all of them were. Then if we take all the diets as a whole and we kind of average them all out, just do you wonder, like, well, what are some of the top benefits of diets for autism? Attention was number one, cognition, irritability, health, hyperactivity, aggression and agitation, anxiety, constipation, diarrhea, language, eczema, stimming. I won't go into all of the rest of them. Social interaction, which I think is important because it's one of those core symptoms in autism. Sleep is important because sleep can really affect the quality of life of the whole family, and the ability for their brain to be really healthy, because we need that sleep to rest and recover and rejuvenate the brain at night. And then what we also found out was that different diets improved different symptoms. So we're able to see that while all diets generally helped, certain diets had better effects than other diets. And I think kind of the classic example that probably most of us are aware of are the ketogenic diet and seizures. So we've known for decades that the ketogenic diet is particularly beneficial for helping improve seizures. This study showed that. So for the percentage of people that had seizures, this diet, the ketogenic diet, was the best diet by far for people that had seizures. We can look at other diets as well. And as we go through this, I will highlight a few of those differences where certain diets were much better at helping with certain symptoms. And another, I think, great point of this is another way we can start to differentiate our approach as clinicians so that we're able to look at symptoms as one of the ways that we can start to figure out which dietary approach might be the best for an individual. So a healthy diet, it was defined as an intake that was high in vegetables, fruits, and protein, and low in junk food. And the healthy diet was the top diet for improving health. So that makes a lot of sense. And health was less illnesses and less severity of illness. It had a general benefit for a vast majority, of 2/3 of the individuals. It helped with constipation and cognition, attention, irritability, anxiety, hyperactivity, and a number of different things. So even just working on a healthy diet is a great place to start. And one of the reasons that I feel that therapeutic diets should be incorporating healthy diet principles. Let's talk about sugar and the results of a low sugar diet. So the average American child consumes 17 teaspoons of added sugar per day. So this is not fruit. This is not sugar from fruit and things like that. That is added sugar. And that equals 64 pounds of sugar a year. A really enormous amount. The CDC, so if we compare it to the 17 teaspoons, the CDC recommends no more than 12, and the American Heart Association recommends no more than 6 teaspoons. So 17 is almost 3 times the recommendation. So sugar contributes to ADHD, inflammation, immune system decrease, weight gain, diabetes, cardiovascular disease in children, anxiety, depression. And so in the study, a low sugar diet in ASD helped improve hyperactivity in 43% of individuals. You would be hard pressed to find any treatments out there that help that high of a percentage. 43% of individuals is a quite significant number. Attention improved in 25%, irritability, aggression, health, anxiety, cognition. So this is a low sugar diet is another thing that we don't want to just take for granted. It does have really significant benefits. Artificial dyes. So a study here shows that artificial dyes can contribute to hyperactivity, anxiety, restlessness, behavior, learning, memory, and attentiveness. They can inhibit neurotransmitter function, as well as oxidative stress and histamine release. And histamine can cause lots of different challenges. We know that histamine and mast cell activation is a big problem from the work of Dr. Theo Hardy's and other researchers. We look at ultra-processed foods, and we can see that ultra-processed foods, from a standpoint of mental health conditions like anxiety and depression, there's an association between those. The Feingold diet is a diet that is free of artificial colors, flavors, and preservatives, and low in compounds that are called salicylates, that are naturally occurring compounds actually found in very high polyphenol-rich foods. So this is where it gets to be a point we don't want to be too dogmatic. We want to reduce these foods when we need to reduce them, but don't overly reduce them when we don't need to, because they are found in very nutrient-dense foods like berries and grapes and cinnamon and spices and very good nutrient dense foods. And so what I like to do is reduce the burden on the body, but then work on improving the underlying factors that can affect them. And there's a variety of microbiome and genetic and other biochemical factors that can affect the ability to process these. And that's found in not only ASD, but also ADHD, depression, and IBS. So this sulfation component is found in a number of different conditions. And so that's where we can start to work on how do we personalize the nutrient approach for them and work on the diet as well. So the Feingold diet was the #1 diet for hyperactivity. So actually 45% of individuals improved in hyperactivity with the Feingold diet. So that was the highest in the study. And again, almost 50% of individuals. Also, it was #1 for irritability, aggression, sensory sensitivity, and sleep. We look at gluten and casein. We can see that there are a variety of different ways when we look at those underlying factors that can be improved and some of the mechanisms of action of the diet, that we can start to put some of this together. So we find high gluten and casein opiates in the urine of individuals with autism. So they're converting these proteins, when they're not able to break them down, into opiate-like compounds. And that affects the brain as well as other areas of the body as well. We also know that they are more likely to have IgG antibody response to gluten and casein, creating inflammation and an immune system reaction. And 81% of individuals improved after 3 months on a GFCF diet that had autism. We looked at, or studies look at high inflammatory markers and find those present to gluten and casein in autism. We know that zonulin, which is involved in creating leaky gut, is present in individuals with autism. There are IgE reactions, autoimmune responses, things like cerebral folate deficiency from folate receptor antibody, but other autoimmune reactions are possible as well. And a number of other responses. And so it's not surprising to me that this is one of the diets that we see the most parents using, because it gets very good responses from parents. There is some of the most research on this diet and lots of great benefits from it. So here are some of the studies on that. Here's 4 studies on a gluten-free and casein-free diet improving symptoms in individuals with autism, and a GFCF diet helping those with ADHD. So in our survey, we found that it was the most popular diet. 3 of the 4 most popular diets were gluten-free, casein-free, gluten-free, and casein-free. So those were 3 of the 4. And so the GFCF diet together worked better than the gluten-free diet or the casein-free diet alone. So I think that's important, is to try the full diet. Now, I include soy-free in all of this because many of the same challenges apply. So it can be very inflammatory. I may actually get to this in another slide, so I might be jumping the gun on this. But the opioid response, things like that, are also common in soy. Before the study, we looked at the GFCF and found that it was a top diet. So in the top several different improvements for attention, cognition, language and communication. I see language and communication a lot improve, diarrhea, hyperactivity, social interactions, stimming, and sensory sensitivity. So a very important diet for many of the core symptoms of autism, as well as some of the additional comorbid symptoms. We looked at food avoidance diets based on IgG or IgE testing and food avoidance diets, and we found that these diets had benefits as well. So I won't go through all of them, but the IgG testing and the IgE, that food avoidance based on that, was the second diet overall. And there were no adverse effects associated with it. And it was #1 for eczema and skin, and #2 for reflux and vomiting. And the food avoidance based on observation was in the top 5 diets for 15 of the 24 different symptoms. And this does make sense. If you observe you're intolerant and you avoid it, there's probably reasons for it. So that was being able to help clients and patients to be aware and make observations and do some individual trials and things can really go a long way in creating improvement. Grain-free, low carbohydrate diets. The specific carbohydrate diet is one of these. This is not a low carbohydrate diet. It's a specific carbohydrate diet. So it doesn't allow any grains, starches, or polysaccharide, disaccharide substances. And then it's, I won't go too much into the mechanism of action of this one because it's a little bit more lengthy, but it helps improve digestion and dysbiosis. And we know that carbohydrate digestion is challenges or impairments in that are quite common in autism spectrum disorder. And then there's the paleo diet. This is a bit similar in that there's no grains, there's no legumes, there's no dairy, sugar, or industrial oils on this diet. And then the ketogenic diet is another form of a carbohydrate restricting diet, but in this case, it's a very low carbohydrate diet with a very high fat component and adequate protein. So SCD had good improvements with attention, cognition, anxiety, diarrhea. And the paleo diet, interestingly, was the top diet for tics or Tourette's. Well, in this case, we looked at tics, self-injury, and OCD. And what I think was really interesting, if you do look at my book, I'll tell you more about it later. There is a story in here of a young boy. Well, he's a teenager. He had Tourette's. So he didn't actually have autism. He had Tourette's. And his mom did a variety of different diets over time. And after getting to the paleo diet, he now has no tics anymore. He's actually a pilot, and he's only 16. He flew across the country as a pilot, getting his pilot license, and he had Tourette syndrome going into this, and he is healed to the point that he is now able to fly airplanes. The ketogenic diet, there's a lot of good studies on the ketogenic diet and autism. It's probably one of the top 2 studied diets for ASD. And so there was one paper here that they looked at 15 children with ASD, and they did a modified ketogenic diet with supplemental MCT for 3 months. And they were trying to address that mitochondrial function and improve the ketone and fatty acid production and help the kids that way. And 50% of the children showed moderate to considerable improvement in ADOS and in CARS. So those are different autism rating scales. So 50% of the children. The ketogenic diet is actually the top rated diet for 9 different symptoms. Now, I don't want you to use this information as an end-all be-all answer, because I find that really what we want to do is look at what combination of symptoms does somebody have? Which diet makes the most sense? Which diet is easier to do versus more difficult to do? So I have a 12-step process. And for example, the ketogenic diet is way at step number 11 out of 12, whereas the gluten-free, casein-free diet is the very first diet out of the diet steps. So I think the importance there is, if we jump straight to a ketogenic diet, which some people might do for various reasons, but if we were to do that, it's not what I would typically do, because if you see results, was it the gluten that was taken out? Was it the grains that were taken out? Was it some particular food sensitivity taken out? Was it what was it? Lower carbohydrate? Was it the ketone production? What was it? And it can be hard to tell. So I do like a methodical approach. I find that to be the best way to go. But with that said, it performed incredibly well. It was top for attention, cognition, anxiety, language and communication, social interaction, constipation, seizures, lethargy, and depression. Keep in mind, it is a much more difficult and restrictive diet than, let's say, a gluten-free and dairy-free diet. And so for that reason, it's another reason that I typically will do that diet much later in the process if I feel that what the parents were trying to address didn't get addressed with something else. But again, it depends. If somebody came to you with seizures and, neuroinflammation and, a variety of other things, you might decide to implement it sooner in your process. Additional studies that we didn't talk about or that we didn't study in that paper, but that I use in my practice are the low oxalate diet, the low histamine diet, low amine, low glutamate, GAPS diet, and low FODMAPs diet. So therapeutic diets, they include the healthy foods. I think this is how I put together a therapeutic diet. Include the healthy foods, exclude the problematic foods. Symptoms can be used to guide that approach. So we talked a lot about that. We showed different therapeutic diets affected different symptoms. So this suggests that symptoms may start to guide dietary choices and help create a personalized nutrition approach, but along with those underlying factors. So any testing that you might do. We'll talk about one success story here before we wrap up. So a story of mine, so if you have my book, in the introduction, this is the story of the young boy in the introduction. His name is Matthew. He's in the conclusion as well. So at 4, he had minimal language. He was frequently frustrated. He had anxiety. This led to tantrums. He had severe sleep disturbances that affected the whole family. And his mom really was looking for answers. So she explored a variety of different things, including dietary intervention. She worked with an integrative physician. She did labs and targeted nutrients. She started a GFCF diet. That led to some noticeable improvements. Over time, she tailored the diet further, removed food sensitivities, lowered oxalates for a period of time, addressed yeast, did grain-free diet, a couple different grain-free diets, and found significant improvement in behavior and mood and sleep and cognition along the way with these different diets, each time getting more improvement. She also worked with her physician to address any underlying factors like the microbiome and other things like that. His teachers and therapists noticed the impact of nutrition on his progress. So Matthew he's actually 21 now. He no longer meets the criteria for an autism diagnosis. He graduated from high school. He became an Eagle Scout. He's attending college. He's almost actually done with his current degree, and he's pursuing a passion for writing. He won an award in the writing department at his college, the student of the year in writing and literacy. And he is, his case study, this journey really showcases the potential of a personalized nutrition approach for autism. And at the end of the book, he describes in his own words how important diet and nutrition have been for him, and he still follows those principles today. So a comprehensive diet and nutrition approach is beneficial. I want to wrap up with that it can improve health, learning, behavior, mood, physical symptoms, and many more things. And it should be personalized for each person. So this is a little bit more about me and how to get in touch with me. You can contact me at my email address here, juliematthewsnutrition@gmail.com. You can find some of my autism resources at nourishinghope.com. If you're a practitioner and you're looking to practice bio-individual nutrition and these therapeutic diets. You can find out more about that training at bioindividualnutrition.com. And if you want to find out more about my book, you can go to personalizedautismnutritionplan.com or go to Amazon, look up Julie Matthews Autism Nutrition. You'll find it. If anybody has any questions, let me know. It goes through my 12-step process. It goes into over 300 scientific citations. It goes into common symptoms associated with the different diets, how to implement the diets, food lists, and all sorts of things. So it just came out not even a week ago, last Tuesday. It is currently number 3 in children's health. So I'm very thrilled with its reception. And so anyway, if it's a great resource for you, then I thought I would share it. So let me go ahead. I'm going to stop sharing my screen. And we'll go ahead and have Cindy go ahead and share with us some questions from the audience.
Hi, Julie. We do have quite a few questions. We're going to run through them. We have 4 minutes. Is
Oh
camel
boy.
milk okay for someone on a dairy-free diet?
Is what?
Is camel's milk okay? Is camel milk
I'll
okay?
give you the short version. It can be for some. It's a very different protein. Some people do tolerate it. I like to do an initial trial without it just to be sure, make sure it's not interfering with other things. But sometimes it is fine, and I do talk about it more.
Great. And by the way, everyone, I put the link to Julie's book on Amazon in the chat. Thoughts on raw camel's milk in kids with autism?
Okay, same thing. Helps to rehabilitate the immune system, often not reactive. Some kids really like it. It can be healing for the gut. It's definitely something to at least consider looking into.
Thoughts on a short-term carnivore food plan as an elimination diet?
Great question. I didn't put carnivore in my book only because I went back and forth, but I think it is, I do use it for short-term, like this person said, elimination. Really, sometimes we need to get it way back to the basics and then start from there. And so I do use it. I do think it's advantageous. I'm not totally sure about long-term use of it. I would personally rather figure out, is it the oxalates or the salicylates, or what is it causing the problem, and then have a more robust diet if possible. But I do think it has advantages.
Aside from blood tests, what are some tests you are using to determine personalized nutrition needs?
Okay, well, food sensitivity panels. It depends what it is. If it's oxalates, I look at markers for oxalate, like an organic acid test, or I look at the microbiome and see how that's affected to help determine things. Those are just a few of the top ones off the top of my head.
Great. What's the dosage for cartonine, and how long does it take to see the effect?
It's going to be depend on the age of the individual, and I forget the exact dosage we use in our paper, so maybe check that out. Sometimes for myself, I'll use up to 2 grams a day, but for kids, I usually use less than that. So check out the paper on autism to see that we did the comprehensive nutrition for autism, and it should, I believe, give the dosages that we used for the kids.
Okay. I have some parents who say even with trying to puree and hide health foods into meals, the child is still adverse to eating them, picky eaters. Any
Yes.
thoughts around that?
Yes, texture. Texture is a huge thing. So try to get creative with texture. I talk a lot. There's recipes in my book for this very reason, because it's hard to get kids to eat things if they're picky eaters. And so I have a whole step on picky eaters, and I have a whole section of recipes for picky eaters. So things like carrot chips, kale chips, things that might make it crispy or crunchy, or pureeing it into pancakes in a texture they like. So just in our very brief texture, but also looking at nutrient deficiencies can contribute, as well as the opioids that are in gluten and dairy can contribute to picky eating as well.
Okay. Well, Julie, that was fantastic. We all wish you so much luck with this book. I'm going to rush and order it. I hope everyone else does. We have a Fundamentals of Nutrition course. I shared information about it here that sort of takes us down the road a little bit. Feel free, I put things in there about setting up a one-on-one call to talk about the courses that are right for your practice. Julie Matthews, you're extraordinary, and Psychiatry Redefined thanks you so much.
Well,
Thank
thank
you,
you.
everybody. And
Thank you.
yes, we will be sending around the recording to everybody tomorrow.
Great. And if anyone has questions, please email me at juliematthewsnutrition@gmail.com if I can help you in any way.
Great. Thank you so much. Bye-bye now.